welcome to Misan TV. This is Shanvi. Today we are with Genplayers Pharma Private Limited COO and Genurved Research Head Ramakrishna Aradhyula. Let's have a discussion with him. Hi sir, namaste.
Namaste.
How are you sir?
Fine.
Actually nowadays asthma is the major problem in everyone's life. Due to mainly climate change, we see this health issue in everyone's life. So last time we discussed about Covistum medicine. So how Covistum works with asthma?
So it's a wonderful question. In fact, Covistum is a specially born product for these asthmatic people. So before going to the asthma, I would like to tell you one thing. Today, WHO, World Health Organization, declared that the lung power is the number one predictor for diseases. That means if an individual or human beings, if at all they have to live disease-free, it is the lung power which decides it. See, the problem is you can divide this particular world into two parts. One is pre-COVID and after COVID.
Yeah.
Especially this COVID, every human being or every individual, they fought with the COVID virus and ultimately they lost their lung capacity. Of course, today the people who are surviving, who are remaining in this world, there are the people who got very good lung power. We can conclude like that.
Yeah.
But the problem is after fighting a long fight with the COVID, today lung power got reduced. Number one. Second thing, it doesn't mean that I'm going to tell you that every COVID individual, the people who got attacked with this COVID may go with this particular asthma, but there are fair chances. For the people who fought with the COVID, they may get this particular asthmatic problem. It may not be asthmatic problem, it is a pre-asthmatic problem, but definitely their lung power is at stake until they develop their lung power.
Okay.
See, earlier also in our epics or Puranas, this particular capacity of the lung power is well described, especially Vayu Purana. See, the Vayu Purana is such an elaborate subject. They have described the entire universe after Earth. There are certain places where there is no air. But human beings, they used to travel to the space and they used to come back. That means they are having a higher lung power. If at all you have to take in this particular distance, that means they used to take one breath and they could be able to travel entire space and they used to come back. This is one example. Second example is Jalastambhana.
Okay.
The Duryodhana, one character in Mahabharata, he used to live underwater.
Yeah.
I think in the last episode of the war, he could be able to survive under the water. That means his lung capacity is very high. See, another individual, even in present days also, you can say that where the lung capacity is very high is whales. So their lung capacity is very high. They breathe only 2 beats per minute, whereas our beat is 72. That means we require 72 times our heart to function. That means lungs to function. Now you conclude that this particular lung power is very, very important. This asthmatic attack, you can define it as the respiratory problem where the airways are constricted, swelled and wheezing. A sound will come while they are inhaling the air. This is the problem. The problem is in minor conditions it's not a problem, they can manage. But in major conditions where they fail to breathe, so it may be life-threatening. See, it produces a particular mucus, this thing, which makes the people too difficult for breathing while they are sleeping. This is the asthmatic problem. It's a worst problem. People, they carry the inhalers and they use it, they try to take the breath. See, main symptoms you can say shortness of the breath,
Okay.
and tightness in the chest, and sometimes they may feel the heart pain. Apart from this, there are several conditions where quality of life is also at question because the emolability of the air into their body is very less. Because of this asthmatic problem where they cannot breathe, they cannot take the complete air what their body requires. Second thing is you can just divide this particular asthma into 3 types of asthma. One is exercise induced. The people who do their exercises, especially gym, so they will be having these asthmatic attacks. Why? Because during exercise you require more air. Your airways or the tubes of the air, they may not allow to take more air. At that particular condition, they will have this particular attack and their vessels are constricted, their airways are constricted and it becomes difficult for them to breathe. Okay. This is called exercise-induced asthma. Second thing is occupational. What exactly they are doing, what work they are doing, painters, and these people, depending upon their workplace and everything, sometimes this iron smell, iron dust and all these things also may create some problem for these lungs. And third thing is allergens, pollens, pollen dust, dust mite and pet dengue. For all these things are responsible for this asthmatic attack. Sometimes a harmless pollen of the flowers also creates a big problem for these asthmatics. So if you go on talk like this, there are several problems where you will have these asthmatic attacks. Countlessly it will come. Sometimes they may have 10-15 episodes a day and 24 episodes a day. So it becomes difficult for their quality of life.
Okay.
So what happens is they cannot lead their normal life provided if this asthmatic attack is there. So their intake also is reduced. So automatically they lead into immune problem. If you ask me how Covistrum works, it's a wonderful product. Covistrum is a product which is made up of the cow's first milk. You can take after delivery of the calf, 1 or 2 milks we take it as and we average it. See, this particular Covistrum contains beautiful components, especially immunomodulatory components. They are very, very important for these asthmatic attacks are concerned.
Okay.
So they increase the lung immunity and lung power. Second thing is proline-rich polypeptides. See, the importance of this proline-rich polypeptides, which we call it as PRP, these PRP are the imbibed component of this particular Covistrum. Covistrum contains this particular PRPs. PRPs are very, very important as per asthmatic attacks are concerned. See, during this asthma, this particular PRP reduces the inflammation. They reduces the swelling of the airways. They clear the airways and they increases the inflow of the air to the lungs. This is the beauty of this particular thing. Second thing is there are certain intermediate, it acts or it regulates this particular inflammatory components such as cytokines. Cytokines are very, very important where they play important role in the construction of these airways. Whereas Covistrum play a beautiful role in that particular condition where it dilates this particular construction. So second thing is certain drugs, they create worst for this asthmatic and especially beta blockers. They normally use it for blood pressure. See, beta receptors are situated in the heart as well as in the lungs. So instead of acting on the lung or hearts, these particular beta blockers may act on the lungs, which creates a worsening of the problem. See, during this particular respiratory infections, especially common cold, this particular asthma will become worse. So in that particular conditions, you have to be very careful. And 1 tablet of this Covistrum will take care. It gives the enough immunity, enough strength for the lungs to inhaling, and it gives the enough courage for the human beings to move with asthma.
So for asthma, maximum number of patients will use inhaler only.
Yeah.
So is Covistrum is available in tablet model or inhaler type?
It's a tablet form.
Okay.
In fact, the thing is inhaler is the one which gives the immediate relief to the vessels or tubes of the airway tubes. So it dilates it.
Okay.
But this particular Covistrum builds or it indirectly or in the body it creates such a strength that your body is intact to receive the asthma attack.
Okay.
That means this is a very good product. It develops the immunity, it develops the total lung capacity and it develops the lung power.
Okay.
That is what very, very important.
So can we use inhaler while using Covistrum?
You can use it, but in a due course it is not necessary to use inhaler. Normally inhaler is used when the attacks are there.
Yeah.
So if you use Covistrum, automatically after 10 days or 15 days, automatically asthma will go away and definitely you need not use inhalers at all.
Okay. Is there any side effects while using both inhaler and also Covistrum medicine?
No side effects at all. Why? Because this is made up of cow's first milk. So it's only nothing but milk. So there is no question of side effects at all.
Okay. Is there any side effects?
No side
No
effects
side
at all.
effects. So how can we get this available?
See, there is a number which is scrolling here. No, you can call to this number. So our telecallers will answer you and they will deliver the product at your doorsteps.
Okay. Thank you, sir.
Thank you very much.